traumatic stress disorder in refugees, and avoidable health crisis. Globalization has given rise to the world's worst refugee crisis since World War II. In hope for a better future, some migrants enter another country by crossing borders either legally or illegally, en route to their country of sanctuary. Some of these immigrants die from the trauma of the journey, while others witness their family members being sexually assaulted and raped. Thus, within twinkling of an eye, their lives can change drastically for worse or better. Recent studies on refugees from all 7 continents shows that refugees suffer from symptoms of depression, anxiety, and PTSD, along with other health problems. On resettlement to US, immigrants have linguistic problems and become ostracized by indigenous within their communities. This led for immigrants to become poorer, culturally crushed, and have self-identity problem. According to Rough et al. 2010, exposure to traumatic stress disorder, including sexual abuse, physical maltreatment, and increases the likelihood of serious mental health problems like PTSD in children. Refugee immigrant adolescents are also at risk of developing emotional and psychological stress, either from being active participants in armed conflict or in response to the demanding situations in the camps or community they reside. Undocumented immigrants are also afraid of arrest and deportation, and many may remain hidden in their host country and avoid getting employment, thereby living in an unhealthy condition, even worse than they are in their own country. The United Nations Children's Fund, UNICEF, reported civilian war casualties has increased from 20% to 90%, and that at least half of them are children. As healthcare providers, we need to be aware of commonly reported symptoms of PTSD, such as anxiety, depression, grief, somatic complaint, which can be a starting point to inquire about the disorder. The problem also is that these refugees mostly avoid going to the hospitals and also tend to avoid discussing previous traumatic events, as they would rather concentrate on surviving in the present than being stuck in the past. When it comes to treatment for PTSD, there is scarcity of effective adequate treatment and study group due to lack of funds and also unwillingness of the migrants in the camps to participate in such studies. Undocumented women immigrants are also more subjected to domestic violence and assault, and also more likely not to take their children for a medical checkup for the fear of being reported and deported by Homeland Security agents. According to Kelly and Peach, 2014, treatment for women with PTSD include quality of life improvement, social support, and self-efficacy empowerment, irrespective of these women's cultural and ethical background. According to Gaffner Besney, 2001, focus for PTSD treatment should be on building trust and helping clients to differentiate between past and present, as this helps them to put label on source of origin of their fears. Also, conceptualizing treatment on clients' preferences is very important, as it enhances clients' self-esteem and engagement in therapy, thereby making treatment to succeed. Also, Oman and Hoffman 2013 stated that psychotherapy treatment is better for children than with PTSD than no treatment at all. Politicians add to immigrant stress by allowing indigenous within the communities to have xenophobia, and also by cutting funds for healthcare services and other welfare programs. These cutbacks will accumulate to the health disparities among these vulnerable populations. As immigrants' emotional stress increases, fear of repatriation and re-exposure to traumatic events, along with failure of clinicians to understand loss from a client's perspectives, can lead to increase in PTSD. Therefore, intervention for care without establishment of safety can lead to PTSD as a health crisis in this underserved, vulnerable population in our society.